Good evening, everyone, and thank you for choosing to spend your Tuesday evening with us to talk about laminitis. I'm going to keep this introduction very short and sweet because I know we've got a lot to get through tonight. Just as a quick introduction to myself, my name is Katie and I head up the marketing team here at SEIB, and I'll be chatting you through a couple of bits throughout the webinar, managing the question and answer session at the end. Hopefully you'll all be aware who SEIB are, but in brief, we're an equestrian insurance broker and we've been specialising all things horsey insurance for over 60 years. But without further ado, I want to dive straight into this webinar. And first up, we've got the lovely Lily Fraser from Paton Lee Veterinary Surgery.
So we're going to run through basically everything about laminitis in a nutshell, ranging from the clinical signs, what to do from your end, treatment options, management, X-rays and their importance, how to monitor your laminitic patient, and then what else you can do to look after them. Okay. So what is laminitis? There's technically 3 different types of laminitis. The one we're mostly focusing on tonight is about your EMS and Cushing's related ones, so called endocrinopathic laminitis. And then we also have your septic laminitis, which comes from when your horse has septicemia. It's a secondary complication. And there's also a type called supporting limb laminitis, which is if you have a horse with a fracture or a cast and they're constantly standing on one leg, you then get laminitis in the other leg. So those 2 are just something to be aware of, but it's not the focus of this evening. So firstly, EMS, equine metabolic syndrome, is sort of the current buzzword around laminitis. It's a combination of these 3 things: your basal hyperinsulinemia, post-feed hyperinsulinemia, and tissue insulin resistance. But the fundamental overall theme is this insulin dysregulation. So as you can see from over here, it is a combination of genetics and the environment and management in these horses. So there is a genetic predisposition in your most native breeds, particularly in your Welshies, but it can also be brought in and also worsened by environment and management as well. So essentially your insulin dysregulation is similar to your diabetes. It's where the body is chucking out too much insulin, which is a response to excess glucose, so sugar in the blood and in the body. So the pancreas keeps throwing out your insulin, and the cells that are supposed to respond to it stop responding, essentially, which is when you get your tissue insulin resistance, because the cells just don't respond as they should be. So your basal hyperinsulinemia, part of it is essentially that you've constantly got within the blood, you've got a constant high circulating level of insulin, which is it can peak, but it never really troughs. It never goes down because the body doesn't ever reabsorb it and respond appropriately. You'll then get a post-feed hyperinsulinemia. So that's essentially after the pony's eaten, you then get this spike in insulin. And that is what happens to start with. So your pony will eat the grass, it gets a spike and it goes back down a bit, and then each time it doesn't go back down quite so far, so you start to build up your basal hyperinsulinemia. And then because you have this constant stimulation from your insulin, you then get your tissue insulin resistance. So it's a constant cycle. And then you also can factor in your adiposity, so that's your fatness, and the fat cells that create inflammatory markers and things within the body. We also have now a new understanding of fat dysfunction. So when you have skinny ponies, sort of externally skinny ponies, but they still have really high insulin, we now understand that it's to do actually with the fat that's inside that you can't necessarily see, and that it's classed as sort of bad fat, for want of a better term. And then you've got your PPID, which is also known as Cushing, so your more classical understood concept. And basically, if you don't have to have all of those, and you have some of them, plus your genetic predisposition, plus your environment management, all leads to your equine metabolic syndrome, and then that leads to your laminitis. So the understanding essentially is that the body constantly has an overreaction whenever there's any sort of sugar presented to it. It creates this massive insulin spike, and that we now know triggers the laminitis. It triggers the inflammation in the feet. We haven't, as a profession, we haven't 100% worked out the exact cellular pathway, but we do know that you need to have a high level of insulin to cause the laminitis. They've done studies of it. And essentially they hooked the ponies up to a drip of insulin, and every single pony, no matter what its original status was or breed, did then develop laminitis within 24 to 48 hours. So we know that the insulin is the driving factor, which is where we've got this slight change of thought process and what we're going to be testing for compared to perhaps even 5 or 10 years ago. You can see here from this study that we've got 2 ponies, and you've got Princess, which does have the insulin dysregulation, and Pickle that doesn't. And you can see with each of these feeds, so the haylage, as I'm sure most people will know, is going to have much higher sugar, and you get much higher insulin response. So that's going up to 300 there for Princess. Pickles, you get a little bit of a raise, but not very much. And you can also just see how prolonged that insulin response is. You know, we're getting up to sort of close to 200 minutes, and we're still at the peak there. So it takes a lot longer to come down than it does for a normal pony. Over here on the left hand side, we've got your Caro light syrup, which is one of the tests that we do to officially diagnose your pony with equine metabolic syndrome. So on the testing, there's 2 options. So we can take what's called your basal insulin. So that's just your baseline of what it is on day 1. And this is often what we do when your pony becomes acutely laminitic, is we say, like, on the current diet, on this day right now, what is the circulating insulin level? And as I'm sure you can appreciate from these graphs, it does fluctuate. So it might be, you know, if the pony's feeling very sorry for himself and not eating that much, the basal won't be that high that day. But what we tend to find is on the true bad equine metabolic syndrome ponies, is that the basal insulin, because it's always so high and overstimulated, is ridiculously high on day 1. So our machine, for instance, only reads up to 250, and we quite often get 250 plus readings on the machine. So that's what the basal's for, and it's very useful for your initial baseline of saying, okay, on this diet the pony has got this insulin and it's at risk, and then you retest it when you've changed your diet and you know how at risk your pony is, and how we're managing it and whether the management is working. Then there's some that come in the sort of grey area, or some that we're testing almost before they've got the laminitis, so you're sort of a risk check, and that's when your Caro light comes in really helpful, because it's that what we class as a dynamic test. So we're simulating as if your pony's gone out and eaten loads and loads of grass. So you can see on the far left that we get this peak. It's nowhere near as high as the haylage, but it still simulates it enough that we can get an answer of, yes, if I give my pony more sugar, it certainly will have high insulin, so therefore it's at risk. And that's the using of the testing, essentially. So you've got your 2 options. Basal is easy because that's in it's just whatever the horse is eating that day. Caro light, slightly more involved because you have to give the pony the syrup, and we have to arrive in the right time frame, but it's still just a simple blood test, so it's not too complicated to diagnose. As I've mentioned, some people are moving more towards this checking of the pony's risk before turnout. So about now, or preferably almost a month ago, before we start looking to move your ponies out, we've started running this as a practice, and I believe there are other practices running it, of sort of a laminitis risk assessment. We called it a metabolic health check. And essentially what we're offering is a full health check, quite literally from head to toe, so a full clinical exam, checking your pony's feet in terms of their health and if they've got any digital pulses or heat, and then we will have a discussion about your pony's weight, and then which will sort of mostly revolve around the use of a weigh tape and advising you on how to use that to monitor, and then your body condition scoring, which is another important factor, and how to go about that. And then again, we will give simple diet advice, because that's not our area of expertise. That's what Dengie are here for. And then we can also advise on exercise. This is obviously for your non-acutely laminitic ponies. We won't be exercising them. So this is, again, all in advance of your active laminitis issues. And then we were offering a blood test for your basal insulin and plus or minus Cushing's, depending on how old your pony is. And then for an additional fee, we are offering x-rays. So as I said, this is the specific offer that we're running at our practice, but it's become quite popular, and we had a particularly bad year last year because the grass never stopped growing. So we had some horrendous laminitis. So this is our idea to try and help advise on the risk for your pony and how best to keep them healthy and happy. So then the other side of things, which most people are quite aware of because it's been around for quite a long time, is your Cushing's, which its proper name is PPID, which stands for pituitary pars intermedia disease. So essentially in your brain, in our brain and there's a little area called the pituitary gland, and it controls all sorts of hormones. There's different parts to it, and you get a benign growth in one area that triggers this Cushing's disease in the pony. So it's not cancerous, but it is a growth, and it does progress, which is why it's a sort of progressive disease. And historically, we've known that it causes, puts them at more higher risk of laminitis if they've got a high Cushing's result. And so we've been focusing on your ACTH, which is your, again, a basal test. And that's been a really useful monitoring tool. And it's been around for at least 10, 15 years. And lots of people have sort of Presend and Pergolide and things for that. That's quite well known. We also have a TRH stim test, which again, it's a little bit like the Carolite. We're stimulating the body to come up with a response. So that's for your sort of grey zone ponies where you do your basal ACTH and you're not 100% convinced it's in that sort of grey zone. So you stimulate the body and see if you get an exaggerated response or not as to whether you're going to diagnose the pony with Cushing's. So again, it's still very useful, and we know that a pony that has PPID is at greater risk of laminitis, so it still needs to be diagnosed and treated and managed. But we are starting to shift our focus as a profession more to the insulin, because we now know that that is the clinical driving factor. And the current thought is that a pony that has Cushing's, there's a link to increased insulin, but we, as I said, we haven't 100% got the exact cellular pathways down as a profession. They're working very hard to research it, but that's still the slight missing link, but we know that it does all link up. So your clinical signs of laminitis, they can be quite varied. The most obvious one is just reluctant to walk. Pony won't come out of the stable, won't come out of the field. You can also get where they don't want to weight bear on one foot, which can literally be them holding it up, or sometimes it's I can pick out one front foot, but they won't stand and let me pick out the other one because they don't want to put the weight on the sore foot. Weight shifting, so just sort of gently rocking backwards and forwards or picking up one foot and then the other. The easy to feel ones are heat in the feet, so compare front left and front right, but always compare them to the back feet as well, because most of the time you get your laminitis in the front, but you can also, we have had some laminitis just in the back feet and some just in one back foot, so compare all 4 feet to each other. Your raised digital pulses, so essentially on the back of the fetlock you've got 2 little bundles, and when there's inflammation in the foot you get increased blood flow, so you can feel increased pulse. It's not the easiest and it's really difficult if you've got a thickened skin pony or a feathered pony. So some owners can feel them, and that's great if you're happy feeling them, but that's what we're often feeling for when we feel down your pony's legs. And then some of them are really sore and they lie down a lot, some sort of excessively, or some might just be seen lying down in the field more regularly than others. And then your more classic proper leaning back, sort of almost downward dog stance. It's quite exaggerated. Hopefully not too many of them get to that stage, but some do. And you can get things more subtly, like doesn't want to walk on the stones but is happy walking on the grass, and more that sort of foot sore side of things rather than acutely painful. So what are we going to do if we diagnose your pony with laminitis? So whether it's sort of the first episode or it's a recurrent or a flare-up, as some people refer to them, the first point of call is always going to be pain relief, because it's a very painful condition. I'm sure everyone's had sore feet when you've had blisters or gone for a long walk. It's the same idea. Your feet are so sore and you just want to take the pain away. So we reach for butes most of the time, or Danilon if the horse has particular taste preference, and that's a really potent anti-inflammatory. So that is a really good starting point. We also supplement with paracetamol. Just literally the human paracetamol, because the issue with bute, as probably most of you know, is that it affects the gut quite a lot, and it can inflame the gut and make it you can lead to diarrhea and things. So we don't want them on a very high dose of that for too long. The paracetamol is a lot safer, just the way it works is very different, so we can keep them on that for a longer term with limited issues, and also just where it works slightly differently on the pain pathway. They complement each other really well. So then on top of your medication, we can put soul support on, which there's an image over here on the right hand side. So it's essentially a putty, and you combine the two parts and it solidifies, so you get forms a really nice pad across the sole. And we when we put it on, you sort of wedge it up slightly to give them a wedge heel, which means they're not putting so much pressure on their sole and therefore not on the tip of their pedal bone. And we just wrap it and duct tape it on, and it works really well, mostly in your smaller ponies where they're not putting so much weight. You know, a big 16-hand horses isn't going to make much difference, but your little Shetlands and Welshies and things, it works really well. And you can often see almost as soon as they put the foot back down, they're like, oh, actually it's not quite so painful now. And then for other options, we've got ACP, which is known as Relaquin or Sedlin, so the oral anti-anxiety medication. That's mostly encourages them to lie down because they're a lot calmer, and it's for those ones that are stressed on box rest is the main use for it now, but it's just an additional option. And then so we need to do your blood test to check for Cushing's or EMS. The Cushing's bloods can be artificially raised when the pony is acutely painful, so we probably won't test that on the first visit. We'll test it slightly later on, and also because there's a delay in that how the medication takes effect, it will help in the long term, but it's not going to be provide much immediate cure or pain relief, so it's not as urgent. The most important one is checking your insulin, whether you go for a basal, and that might be incredibly high, in which case you've got your answer, or if it's not that high, then you do your Carolite. And then so you've got your diagnosis of insulin dysregulation and to what extent, and then plus or minus the Cushing's as well. And the Cushing's is your typical tablet. It's we've got Pergoquin in at the practice at the moment, or it was called Presend for a while, and the drug is called Pergolide, and it just comes in tablet form and is normally quite reasonably well taken. And then there is now another option for injectable version, which is called Cabergoline, because some ponies don't seem to tolerate the Pergolide very well. It can make them a bit depressed and go off food, and some just refuse to eat it. And you do point with some of them where they're on sort of two and a bit tablets, and it actually works out more cost efficient to have the Cabergoline injections, and owners can do that themselves if they feel comfortable, and it's just a once weekly injection. So we have had quite a few move on to that when they've been on medication for long term. Then EMS, so this is again, it's quite an emerging area of research and therefore drugs. So we've got this new medication, which is quite hard to say. It's called ertugliflozin. And it is based off of human diabetes treatments, and also dogs and cats as well. And it's called an SGLT2 inhibitor, which is a type of receptor in your kidney. So it stops that working, and then the glucose is taken out of the blood into the urine more so than in a normal setting. So we're blocking the receptor that normally keeps the glucose in the blood, basically. And the idea is that because they urinate out the glucose, you then have less circulating glucose, so the pancreas stops sending out quite so much insulin, and it just resets everything. So we kind of think of it as a metabolic reset, trying to get that insulin back under control. And then once you get your insulin under control, you quite quickly see how much more comfortable the ponies are. There was a study recently, and even within 4 days of being treated, you saw significant increase in comfort and reduction in lameness levels. So it's a really, really good drug. It is quite new, so there's not strict protocols on how to use it. We obviously have a protocol on the safe dosing, but in terms of length of time of using it and things, it's still very much as a profession a learning curve. And again, with all medication, some horses respond to it and tolerate it really, really well, some not so much. It does have a bit of an effect on the liver, so we have to take that into account when we're deciding whether to put your ponies on this medication or not. But on the whole, we've had some really, really good results with it, and it's particularly useful for encouraging weight loss whilst on box rest, because obviously on box rest you can't exercise them, so we need the easier way to get rid of the weights to try and stop putting so much weight through your sore feet, reducing your fat so that you've got less of those inflammatory markers coming from the fat, and then obviously overall reducing your insulin. It's not a long-term solution. As I say, it has some effect on the liver, so we can't use it forever, and it's it has the receptors have a limited susceptibility to it. So at the moment we're sort of using it for 1 to 3 months at a time. It's very case specific, and some of them we're using it when we turn out, and some it's just whilst they're on that box rest. And we have had a few people whose ponies we've decided are incredibly high risk of laminitis for one reason or another, and have started on it preemptively. Now, we've not had many of those, but that might be the way things are starting to shift a little bit more with these, these ponies that are on a really strict diet, but you just cannot get the weight off of them, and they're starting to look a bit too at risk. So it is really good. As this Horse and Hound article says, but good, yeah, you still need the good management. It's not a long-term solution, it's just an adjunct. So then we've done your initial sort of first aid treatment, taken bloods to diagnose your pony with EMS and Cushing's. So then what's the next step? And it's going to be x-rays of the feet. Normally we go for the front 2 feet, because as I said, that's where you're normally laminitic. Some will do all 4. And why is it so useful? Well, it gives you much more accurate prognosis. I can tell you, if you've got very little sole depth there, then that's a very different prognosis to one that's got loads of sole, and then your rotation as well. Again, it gives a definitive diagnosis of the condition, because you can have other reasons why you've got raised pulses and sore feet, like abscesses or just severe deep bruising. And also it just gives us better ways of giving immediate care, so we can fit our sole support more accurately, we can liaise with the farrier, and we just know so much more. You can see from the x-ray on the right hand side how many different measurements we can take for one x-ray. So you've got your rotation between the pedal bone, which is your bottom sort of triangular bone, you can see at the bottom there, and your hoof caps. Also, those should be parallel lines, so you can look at the rotation from there. You can measure the depth of the sole, which you can just about see at the bottom where it says 1.11 centimeters. And then we can also look at if your so your pedal bone has dropped down from the coronary band, and so you can see so many things essentially. And then the main useful thing is monitoring a progression or improvement. So we have some that they respond initially and then they sort of flatline and don't seem to be getting more comfortable, so we repeat the x-rays to see, have we got further rotation, have we got separation and gas building up in there. You can get in the front where the hoof wall separates from the pedal bone, you can get seromas and abscesses that sometimes need draining, and then the biggest thing is for assisting the farrier so that he can or she can trim that foot back. So we want to get the heel flatter so that they're putting more weight back through their heel and less pressure on that pedal bone. And when we get to the point of putting on shoes, whether they're glue on or proper shoes, then it just gives you so much more information about what you've got to work with in there essentially. And it can also be obviously quite sadly if you kind of get to almost the end stage and you just can't, it's not working at all and you just can't get things under control, and just having that clear image to say, okay, we've kind of reached the end of the road, we're not going to get any further of this, unfortunately. Again, it's just a very useful thing, and it's also quite useful if you have a chronic laminitic to be able to track back year on year and see what's changed, how bad is this. And some of them will never get back to 0 degrees. For some horses sort of 5 to 10 is their normal, but if you've got that chronicity and those repeat x-rays, you can at least know what is an acceptable level for that pony compared to another one. So they're incredibly useful is essentially the summary of that. So the management, the primary principles is strict box rest, which I appreciate is quite difficult for some horses, and some owners and some yards don't make it easy. But essentially the more they move, the more you get stretching of the laminae, which are holding that pedal bone. So the more movement, the more stretching, and then the more risk of that pedal bone sinking and eventually coming through the bottom of the foot, which is end stage. You can't get back from that. So that's the main reason why we keep them on such strict box rest. I know it's really difficult for some of them. They get very stressed, they're away from their friends, some people don't have a stable or things, so there's some flexibility, but the simple thing is the more stable they are, the better prognosis essentially. If they keep moving around on those unstable feet, then you're sort of ticking time bomb essentially. And then the farrier, liaising with the farrier is the most important thing. It's a team approach to these cases. They have their expertise and we have ours, and we need to combine the two. So the The feet grow very quickly because you've got so much blood flow to them because they're inflamed, so they'll probably need more regular trimming. And you often find that we have to change things as to how you would normally deal with a farrier. And also the x-rays, it's amazing what some of these feet look in internally compared to what they look at externally. So it just gives them so much more information. And you often see farriers are a little bit braver with the trim, especially on the toe, because they know they've got that bit more knowledge of how far back they can go. And sometimes when it works out really well, we can take a x-ray, the farrier trims a bit, we take another one whilst we're all there, and if then we think we need to do a bit more, you can repeat it. So it works really well on that side. It doesn't always work logistically, so we're often taking the x-rays in advance of the farrier coming, but it's at least it's better than nothing if we do it that way round. And then the shoes options, there are so many options, but essentially most of the time we take the shoes off if they're on, to allow the foot to relax, because you've essentially got a metal trap holding it in place, so that aggravates the pain. So we take it off, let the hoof relax, and then once we've got we're less actively laminitic, then we will move to thinking about some sort of shoe. And at the moment the most popular one is sort of what we call the imprint shoes, which are the glue-on shoes with a pad underneath for extra solar support, and those seem to be tolerated really, really well. Some of the small ponies where they don't have so much weight through them, then just deep bedding and sort of sole support is more than enough. But there's quite a lot of variation. There's clogs, there's hoof boots, there's so many different things you can go down, different routes, and it just depends on the horse and what the feet are that we're dealing with. And then diet, which is going to be Tracey's area of expertise, so I won't go on about that too much, but we're essentially going for a low sugar diet, and the primary principle is your weighed and soaked hay ration, because we need to stop stimulating the body so that insulin starts to come down and get back under control. So that I'll leave Tracey to go through more of that. So to monitor your own laminitic once we've left the yard, so the most important thing is communicating with us and your farrier, but for us, we get invested in your ponies, but they are your only pony or your main concern, and we do have quite a lot, so we need you guys to sort of do your active bit of please to send us lots of messages, even if it's just, oh, he walked a bit better, or I could pick his feet out today, or a video of him walking around the yard, anything simple like that. We need sort of the active side from you guys of just I don't mind having constant updates. I might not get back to you that day, but I like to have the updates rather than wondering, oh, I wonder how this pony's getting on, I haven't heard from them for a long time. So it's then important that we keep up with our visits and timing around with the farrier visits as well. Often with a laminitic, depends how bad they are, but I normally like to see them at least a week after the first visit to see how we're getting on, and then sort of probably every 2 weeks or so, depending on how stable we are and what the farrier's done in between as well. And then if we do start you on atigliflozin, which is your drug for your EMS, we will do repeat blood samples. So we'll normally 2 to 4 weeks after starting it, we'll check your insulin levels. And as I said, because it has a small effect on the liver, we do just keep an eye on the liver values too. So that's what that is needed. Your Cushing's takes 6 weeks, so that we will do a repeat blood test, but that takes a little bit longer to need to be done. And then repeat x-rays, so we know exactly where we are, we know where to trim to, we know how much sole we've got to work with essentially, because it's quite interesting. The foot you see externally is often quite different to the foot that you see on an x-ray, so all important things. And then obviously for you, it's just keeping an eye on your pony's comfort. So is there heat in the feet? If you can feel the pulses and you're happy feeling them, that's great. But you're essentially going, can they lift their feet up? Are they lying down less if they're one that's been lying down a bit? Are they a bit happier themselves? Are they moving around the stable? Those are all your sort of monitoring tools that you can use yourselves when at home. And then yes, so diet, we're looking for low sugar and starch to try and minimize that insulin peak, and so what we're looking for a weight loss diet is 1.5% ish of their body weight per day in forage. Again, Tracey's going to go through this in a bit more detail, but you're wanting to soak your hay for a minimum of 6 hours, and then once they're allowed out, you do have to manage the grazing. It's not many of these can go back out onto a normal lifestyle, so whether that's a shorter time period, a different time period, night versus day, strip grazing or a grazing muzzle. And again, Tracey's going to go through these a little bit more, so I'll leave that area to her expertise. And then so exercise wise, we're looking for sort of this is obviously once they're fully sound and no longer laminitic, ideally 3 to 5 times per week, around about 20 minutes. You basically want them to get a good sweat on, because the more they exercise, the more the muscle uses up the glucose and the sugars in the blood, so then you get less insulin response from the body. So EMS is technically reversible with correct management and exercise. It's not curable. They will always be at risk. So, you know, even if you got their insulin under control, if you chuck them out in a really long lush field, they will still get laminitis. It's not a case of I've got the insulin back under control, I can just return to normal. You need to be really strict and keep on in order to keep your pony healthy. So we need them to exercise efficiently. So 3 to 5 times a week, depending on the horse, but basically we need to get a good sweat on. So whether that's a few times a week for an hour versus shorter times more frequently. It does get a little bit harder with your older ponies. The issue is with your when they're older, are they retired because you've outgrown them but they're otherwise well, or are they retired because they have significant orthopedic issues? So those guys are a little bit harder to manage, and so it's sort of as much as you can do without making their other conditions worse. So hand walking is great, if you can walk them out for an hour or two, that's going to use up quite a significant amount of glucose. Long lining, lunging is great, if they're not able to be ridden because you've outgrown them, or they're not that sound ridden, but they're able to be lunged on a soft surface for even 15 minutes or so, that's great. And then you come into these things with your track systems to get them keep walking around, and your hay balls, again, anything that keeps them gently moving, just to use up a bit more of that glucose and reduce the insulin response in the body is the idea. And I think that's all of my part of the talk.
Thank you, Lily. There is a lot to think about, isn't there? And I'm sure there's going to be tons of really good questions at the end. Let me share my screen because we're now back over to me. Right, hopefully everybody can see that. So I'm going to quickly run through the insurance side of things. So we had a chat with our horse insurance claims team here at SEIB, and we just wanted to find out roughly what's been going on the laminitis claims front over the last 5 years. And what we discovered was that there's 3 key takeaway points. One is that there's been a 46% increase in the number of laminitis claims in the last 5 years. The second is that there's been a 27% increase in the cost of laminitis claims. And the third is that the average cost of a laminitis claims comes in at over £2,300. So it's pretty pricey. As well as chatting to the claims team, we also caught up with a client of ours, Diane, just to get her story about her Arab star. So I'll quickly summarise this. I won't read it word for word because obviously there's a lot on there. But so Star had chronic laminitis and EMS. His insulin levels were 278 and they were supposed to be under 20. He also had a 16% rotation. Star's treatment basically included 3 months complete box rest, as Lily mentioned earlier, minimal movement. He was on 2 bute per day and just 6 kilograms of soaked hay every day. Again, as Lily mentioned earlier, it was a real team effort to get Star back to feeling well, and she worked really closely with her vet and her farrier throughout Star's treatment. Star had a series of x-rays, heart bar shoes that come in at £120 a set. He then needed to have clogs, which come in at £472 a set. Luckily, after 2 months, he could move on to gel inserts and pads, which brought the cost down a little bit to £200 per set. In Diane and Star's case, she used the full £5,000 vet fees limit that's available on the SEIB Classic Horse Insurance policy, showing just how handy it can be to have insurance in place when the worst happens. It's a lot of money. We don't always have it in our bank account, so it's always handy to have insurance there just in case. On the next slide, we've just got a list of some of the extra things that Diane mentioned. Some of the things that, you might not necessarily add to the vet's bill, but it's definitely on there. The cost of rubber matting, extra bedding, hay gain ring feeders, large containers to soak hay, additional hay nets. There's all these extra little bits that really can make that vet's bill rise. But the good news is that we're pleased to say that Star is now doing really well and living a normal life, going out hacking. So all of the hard work that Diane and her team of experts put in really did pay off. Okay, so now that we've covered the veterinary side of things with Lily and the insurance side of things with me, I'm going to hand over to Tracey from Dengie Horse Foods, who's going to talk you through feeding a horse with laminitis.
Thank you very much. I'm just going to share my slides, hopefully. There we go. So it can all be really quite kind of overwhelming. Once, you know, perhaps your vet's been to visit your horse, you may have one with active laminitis, or you may have just been advised that your horse is at risk of laminitis and potentially needs to lose weight. So where do you kind of begin, really, because it is quite scary. So there's three things that I would encourage you to think about if you are in this situation, and that is your grazing, your forage and your bucket feed. The bucket feed is actually the easiest thing to sort out, so I'm going to be spending the least amount of time talking about that, but actually thinking about your grazing and your forage, they can be more tricky and labour intensive to manage. So our main aims when we're encouraging kind of weight loss, or we're looking to manage the laminitis prone individual, is first and foremost to reduce their calorie intake whilst maintaining their eating time, because that's really important for their behavioural health and their digestive health as well. And for those that are laminitis prone with insulin dysregulation, we also want to manage their intake of non-structural carbohydrates. And when you're doing any kind of research with regards to laminitis, you will come across a lot of abbreviations, and NSC is one of the ones that you will see quite frequently. So just briefly to explain that, what that is, non-structural carbohydrate is actually an analysis term, and it's a term for the sum of water-soluble carbohydrates, or WSC, which is actually your simple sugars all the way up to fructan as well, and starch added together. And unfortunately, this can be really highly variable in both fresh and conserved forages, which is what makes feeding them quite tricky. So starting off with grazing, which is the biggest thing to try and manage. Grass is a big part of the obesity problem. Looking at this graph here, we've got a 500 kilo horse out at grass 24/7, assuming it's having kind of roughly as much as it wants to eat. And we've got some examples of the types or the amount of energy that it might be consuming whilst it's out at grass across the different seasons. So from that graph, you can see that its energy intake, which is the yellow line shown as DE, or digestible energy, far exceeds its requirements, both in terms of maintenance and also light work in green as well, especially at this time of year. So during the spring, heading into the summer, grass is less mature, it's very digestible, the horse can get a lot from it. So their energy intake can be more than double their requirements. So it is normal for horses in the wild, for example, to certainly put on weight at this time of year, and then it may only be in the winter months when that energy intake dips below what they need, and we should be expecting to see some weight loss during the winter. It's this interruption of this seasonal weight gain and weight loss cycle which in part is linked to obesity increase year on year, and then the potential risk of laminitis. Generally for horses, we kind of assume that they eat about 2 to 2.5% of their body weight on a dry matter basis. But it's also important to say here that under some circumstances, ponies have been shown to consume about 5.6% of their body weight on a dry matter basis, which is an incredible amount. So it's no wonder that there is a weight issue associated with grass, and it certainly does need managing. Now, how you manage your horse's grass intake is going to be dependent upon the situation you're in, the yard that you're at, your ability to control grazing, and fundamentally what's going to suit you and your horse. As Lily has already said, if you've got an individual with active laminitis, then you won't be doing any of these things, and it's more about long-term management in this circumstance. So what are the kind of general options available to us? We've got things like a no grass area, so that's probably most suited if you've got a lot of weight to lose. You need total control over what's going in, but you can still maintain contact with other horses and try and enrich that area as much as possible to keep the horse occupied. If your horse is allowed some access to grazing, but we want to limit the amount that they have, then we've got some other options available to us. So things like a grazing muzzle, that won't be popular with everybody, and it certainly doesn't suit every individual horse, and it needs to be introduced with care, but it certainly does reduce the horse's overall intake. So some studies have found up to an 83% reduction in intake through use of a grazing muzzle. Another thing that you can do is to strip graze, and again, studies that have looked specifically at strip grazing have found it an effective measure to limit the horse's intake and therefore reduce the amount of weight that they gain. And you can either do strip grazing by moving a front or a front and a back fence to move your horse across an area of paddock. The other thing that has gained a lot of popularity just recently is track systems as well, and just be aware of what your interpretation of a track system is. I think in their original context they would actually be a grass-free area with hay stations around them. Some people are alternatively using them as a grazing system, so there will still be grass on the track going around the edge of the field. That's absolutely fine if it is suitable for your horse, but just be aware that potentially they could still consume quite a lot of grass if that track isn't restricted enough, if it's across quite a big area. Great from the point of view of encouraging some movement and some exercise, but that won't necessarily outweigh what they can actually consume. Obviously, within the constraints of time tonight, I've only very briefly touched on kind of those options. And as I say, you do need to find something that's going to be suitable for you and your horse. On the Dengie website, if you type in grass into the search engine, I have written an article on our website which goes into much more detail about some of the pros and cons of each of these grass management systems. The other thing that we need to worry about with grass is also the intake of non-structural carbohydrates, which can vary hugely, you know, even across hour by hour, let alone day by day. And there are certain times of the year that are potentially more risky, where if you do have an individual that you know is potentially laminitis prone, you might want to remove them from grass at those times. So things that we want to watch out for, certainly in the spring and the autumn, when overnight temperatures are much kind of chillier and colder, so the grass isn't growing as rapidly, yet the daytimes can still be quite sunny, we might want to restrict grazing then to reduce the intake of non-structural carbohydrates. We can also be concerned about times of drought, so in the summer when the drought conditions are there and then we get rainfall following drought, that can be particularly risky as well, and a time that you might want to pull your horse off of the grass at that stage. Generally, in terms of non-structural carbohydrate intake, if the sun is shining during the daytime and the overnight temperatures are high enough for the grass to actively grow, then your levels of non-structural carbohydrate will be a bit lower in the morning and then increase across the day. So generally the advice is to turn out early in the morning and bring horses off of pasture by mid-morning, but that is highly variable. And what I would just like to say is that although we do know about these differences in non-structural carbohydrate in the grass, actually it's the amount that your horse has to or is able to consume that's really going to affect their intake. So our focus very much needs to be on how much are they able to consume. Now, unfortunately, if you've got a horse on box rest due to laminitis, or you're having to use a no grass area, then our reliance instead shifts to our conserved forages, which again need some careful consideration and management. What you do here may be dependent on what your yard dictates, unfortunately, so you may have quite a limited choice, but again our main aim is to use a low calorie forage to encourage weight loss whilst maintaining chew time. For those with insulin dysregulation, again, we're thinking about this non-structural carbohydrate intake, and consensus here is to try and select a forage with 10 to 12% or less non-structural carbohydrate on a dry matter basis. Now, whilst we can get some kind of an idea of perhaps how calorific a forage is, in that if you squish it in your hand and it's quite coarse and stalky, it probably means it's more fibrous and less digestible, potentially lower in calorie. Visually, there is nothing that we can do to determine the non-structural carbohydrate content of your horse's forage. So for that reason, if you do have a problem and you are able to buy a bigger source of hay or make your own, the advice really is to get it tested so that you know what you're dealing with. Sadly, again, this isn't a cheap option. So, for example, Dengie do offer a forage analysis service, and our laminitis package is £111.58. So there is a cost associated it, but if you've got a good supply and you're going to be buying a big supply, it's probably worth getting it tested. So in terms of the forage types that we have commonly available, we have haylage, hay and straw at our disposal as well. And you can obviously use bagged forage replacers like Dengie Meadow Light with herbs as well. But I just wanted to talk about some of the differences between our long stem forages and their suitability for weight management, or potentially those that are insulin dysregulated as well. So with regards to haylage, it is cut at an earlier botanical age generally than hay, so tends to be more digestible. So immediately for our good doers, it may be a little bit more calorific unless a higher fibre variety is used. If it is a true haylage, then from the point of view of water-soluble carbohydrate and therefore non-structural carbohydrate levels, in a true haylage, some fermentation will occur. So actually WSC levels can be lower than hay based on analysis. My main caveat here is actually you need to get it tested to know that. And actually, of the haylage samples that we've had in for testing over last year, actually only 19% of those, or about 20% of those that were sent in as haylage, were actually haylage. The rest are what we would actually classify as wrapped hay. And for those wrapped hays, then the water-soluble carbohydrate level is very much comparable to hay, so it's not really going to be any different. With haylage, because more of what you're feeding is water, you need by weight to feed more of it. So again, that's why knowing your dry matter and how much we're going to be feeding your horse is important. The other thing to consider with haylage is, on the whole, it tends to be very palatable. It's very tasty for your horse. Now, that can influence their feeding behaviour in that it may actually make them eat more quickly, which can actually then have an impact on their insulin levels as well. The faster they consume it, then the bigger the rise in the insulin level as well. So we do need to consider that as well. Most people tend to feed hay. Tends to be quite available for us, but unfortunately with environmental conditions changing all the time, certainly last year there was a lot more haylage taken than hay because people were struggling to dry it. So with hay, it's cut at a later botanical age, so it is less digestible compared to haylage, but again there can be some variance according to the age when it's taken. The water-soluble carbohydrate levels are, like haylage, entirely influenced by the types of grasses used and the weather conditions during growth and at the time of harvest as well. So for example, a hay that's cut late in the afternoon on a very sunny day is going to be higher in water-soluble carbohydrate than perhaps one that's cut either earlier in the day or on a cloudy day, for example. And again, we can't tell just by looking at the hay what's going to be the case there. As Lily's already mentioned, one of the things that we can do to reduce water-soluble carbohydrate levels in our hay is to soak it. If you start delving into information about this on the internet, you will probably boggle your brain because there are so many different pieces of advice on soaking time and duration. But from the studies that have been done, the general information is that the warmer the water, the greater the losses of water-soluble carbohydrate. The longer the soak time, the greater the losses of water-soluble carbohydrate, and the greater the volume of water, then the greater the losses of water-soluble carbohydrate. So they're the three things to consider. You've also got to consider what's practical for you. So our advice generally is in colder weather, when the water is colder, we want a longer soak. So we say morning for night, for example. But during the summer months, when it's a lot warmer, we might get losses a little bit more quicker. But the other thing that we're quite worried about then is just the palatability of that forage, that hay that's been in for soaking for extended periods of time in hot weather. It doesn't tend to be as nice, and your horse would certainly be very reluctant to eat it, and there may be some hygienic quality issues to think about there too. So during the summer months, if you can soak it perhaps or change the water more regularly, then that would actually be quite ideal. More recently, the thing that we're looking to introduce into the horses' forage net is straw. it's the type of fibre that is least digestible because it's very botanically mature, so it is very low calorie. So straw is something that can be incredibly useful for us, for these individuals that even if perhaps we've reduced the amount that they have to eat, they're still holding on to their weight and we need to reduce their calorie intake. So based on research that's been done at the moment, looking at things like digestive health, for example, then it's suggested that we can replace up to 50% of the forage ration to reduce the calorie intake. And compared to hay, that's about a 20% reduction in energy intake. So it's a really useful thing to do. There is a caveat to it in that horses obviously must have good teeth and it must be introduced very gradually. It's going to present a big dietary change for the horse, so a slow introduction and good teeth are a must if you're going to consider using straw in the forage ration. And we would suggest mixing it through the usual forage ration, be that hay or haylage. Straw doesn't tend to be as palatable as the other things, which we can use to our advantage because it helps to slow the rate of intake of the entire forage ration. So it's very beneficial from that perspective, as well as being low calorie. And I would say even if you've got a horse that point blank refuses to eat straw, some of them do, some of them would rather not eat at all than eat straw, then what you can do is still mix it through your correct quantity of hay or haylage because it will still serve that function of slowing their rate of intake. The other factor with straw, again, highly variable seasonal conditions and environmental changes. Just make sure that it's clean as well. We don't want to be feeding any mouldy forages to our horses, so that's another important point to bear in mind. How much forage is enough? Again, Lily's already mentioned this, but based on current consensus statements, it's 1.5% of the horse's current body weight on a dry matter basis. So if we had a 500 kilo horse, that's 7.5 kilos of dry matter, or 8.8 kilos as fed if the hay is 85% dry matter. So this obviously requires you dusting off your calculator, or that's when you can certainly contact people like myself to help you with that kind of information and working out quantities. Ultimately, we probably will have to reduce the amount that the horse has to eat compared to ad lib feeding, and therefore we should really ideally take some additional measures to slow the rate of intake of that forage consumption. One of the ways that we can do that is simply by dividing our forage presentation into more meals across the day, but we can also slow the rate of intake. Things like small hold hay nets you're probably all very familiar with, and I, for example, used one of those hay balls with my own pony and found it quite useful to keep her entertained and also to encourage a little bit more kind of movement as well, until she got the hang of it, when she worked out that actually she didn't need to move it very far at all. The last thing that we're going to be talking about is bucket feed. And as I said, this really should be the easiest thing to sort out. We just need to think about kind of why we're feeding and what's going into the bucket. So the first thing that I would suggest doing is to remove all the unnecessary extras. A handful of this, a cup of that, it all adds up, and what do you really need to give? Just as an example, something like half a stub scoops of a high fibre cube provides almost as much energy as 1 kilogram of hay, and ultimately what's going to keep your horse chewing and occupied for longer, definitely the thing that they have to spend more time chewing, and that's the hay. So think about what's going in and how you can make it last longer. So we definitely want to go for the long stem forages rather than a pelleted product in that instance. And then we need to think about, well, if, for example, our horses and ponies can get their energy requirements from grazing and forage alone, why do we need to feed at all? And the reason for that is this. What you're seeing on your screens is something from the ration evaluation program that we use called PC Horse, where we can input all the horses' details about what they're consuming, and then it does the sums for us in terms of what that diet is providing. So this diet here is a dieting average hay ration, so 8.8 kilos is fed for a 500 kilo horse. And what that's actually providing that horse with is, energy wise, we're kind of in the okay range, but anything in red is deficient in this circumstance. So lysine, which is one of your essential amino acids, that's supplied in 2 little levels, things like copper, zinc and selenium, as well as vitamin E. And actually, although I've put a dieting horse ration on here, even if we had a normal horse that was having an abundant amount of forage, some of those nutrients would still be in deficit. So we do need to look to feed the horse something. So given the dietary shortfalls in UK pasture and forage, all horses and ponies need supplementing with an additional source of vitamins and minerals, and that can be provided in the form of either a supplement, a balancer, or a fortified feed. And minerals. The other thing to think about is for these dieting individuals, if we're restricting their grass and perhaps restricting the quantity of forage that they have as well, then their dietary deficiency becomes even greater. So you may need some additional advice. You might need to select a slightly higher specification feed or supplement to make sure they're actually getting kind of what they need. But just to give you some details on the differences between a fortified feed, a balancer and supplement, then a fortified feed, so something like the Dengie Healthy Hooves molasses free, one of the big difference compared to the other two items is the feeding rate. So for a 500 kilogram horse, you'd need to provide 2.5 kilos per day in order to give the balanced diet. And for that reason, the energy supplied at the feeding rate is much higher than the other two options. Now, whilst it was higher, all we would really need to be thinking about is including that chopped fibre feed as part of the horse's daily 1.5% of their body weight intake to manage that calorie discrepancy. The other thing that's very different when you look at a fortified feed versus a balancer, or sorry, with a balancer versus a supplement, is the amount of lysine supplied. So you can see for the fortified feed and the balancer, the amount of lysine supplied is much higher than just a vitamin and mineral supplement. So on the whole, your powder vitamin and mineral supplements will be providing you with your vitamins and minerals, but they won't have any appreciable calorie value, and they won't be providing as much quality protein as a balancer or fortified feed. Now you can, if you wanted to, there are amino acid supplements available, so you could just add one of those with your vitamin and mineral supplement, or you can look at the other two options. So one thing that people are always really interested in is how long it might actually take your horse to lose weight. And it's been suggested that weight loss of 0.5 to 1% of body weight per week is realistic. So based on the 0.5% weekly loss, it would take a 500 kilo horse that, say, for example, needs to lose about 100 kilos, around 11.5 months to get there. So we're talking about a year for that 100 kilos difference in that instance. Now, if anybody like me has tried losing weight before, you will know that weight loss isn't a linear thing. It has its plateaus and its stops. So probably not too realistic, but just to give you an idea of how long it might take. On the 5-point fat scoring scale, it takes around 20 to 30 kilos for a 0.5 point change in fat score. So unfortunately, it can take a little while for you to see the difference in your horse's weight. And what we suggest doing is we say weigh tape your horse every couple of weeks and keep logging and monitoring that down to notice the changes, and then do your fat scoring kind of monthly, because it will take a little bit longer to notice the difference. We all love to take photos of our horses, and I'd say it's a really good habit to, on that month, take a side on and a bum on shot of your horse, because actually sometimes it takes you stepping away from them and looking back through things like that to show you the difference over time, to keep you encouraged and keep you on that weight loss journey. And just to end with a case study, he's been a Dengie case study for a long time, and I make no apologies for that because his story is a good one and we've got a lot of data for it. So this is Chewy. He's a 14-2 Connie Cross. He's now in his mid-30s, so he's an older boy now. He had his first laminitis incidents at 9 years old and reoccurring bouts in 2010, 2011, which is when I met him. So he had EMS diagnosed and then latterly PPID. So this is his before and after picture, and very much for Chewy, it was weight that was his issue. Since that time, so 2010, 2011, he has had no further incidents of laminitis, and his owner has worked so hard on his management. She's been absolutely brilliant with some support around her as well. And as I say, we've got a lot of weight data for Chewy over a period of time. So if you look to the left of the graph, his first weight was the 29th of June 2011, and he came down from it was 468 kilos down to 400 kilos on the 30th of June 2012. So it took him about a year to lose that 68 kilos that he initially lost, and which made a very big difference to him. You can see that he lost that as quite a sharp line. During that period of time, he was on box rest. He had to have a lot of remedial farriery and obviously veterinary support as well. So we had a whole team of people working kind of with him. Then 2012, things started to improve. He'd lost the weight and there was some gradual reintroduction of grazing. And further on in 2013 and 2014, you start to see some peaks and troughs in Chewy's weight. And it's very much following that seasonal cycle of weight gain and weight loss. With Chewy, his owner, Rebecca, was using a grazing muzzle. So she'd use the grazing muzzle when the grass was much more abundant, and then remove it at other times when it was really too short to even poke through the hole of the grazing muzzle. So she started to do that. That second big peak there in 2014 is when we had a little bit more of a conversation, because his weight had started to creep up again. And at that time, she openly admitted that she'd stopped weighing his hay. So for long-term weight management, the key is to keep doing the things that you did to get to the good place in the first instance. Subsequent to that, you can see that Chewy, pretty much maintains around the 400 kilo mark. He's dipped below that a few times now, and as I say, he's in his mid-30s now. We're now dealing with different problems in that he's got some dental issues and actually requires a lot more to maintain his weight now, but from feeds that are still very much appropriate for those that are laminitis prone as well. So hopefully that just gives you some encouragement that, if you can get the weight off, and as long as your vet says that it is appropriate to do so, you may be able to reintroduce some grazing and get back to some kind of normality, as long as you continue to manage it well. And that's the end of my presentation. I hand back over.
Thank you, Tracey. That last graph is so interesting. It really highlights this is such a long journey and it's just ongoing, isn't it?
Yes.
Thank you so much for that. Lily, I don't know if you want to pop back on camera, because we're going to do a Q&A now. We've got a couple of questions in the chat function, but I would ask everybody on the webinar if you could use the Q&A button at the top. It should be next to where it says chat. So what I'll do is I'll work my way through the couple of questions that we've got in the chat section. Meanwhile, everybody else, if you could pop your questions in the Q&A bit. We'll work through as many as we can. We probably won't be able to answer all of your questions, but if you email us afterwards, we'll do our best to follow up with you all after the webinar. So the first few questions that I've got in the chat section are for you, Tracey. So we've got one on what sort of straw would you recommend using, barley, oat or wheat?
What you can get available basically, and what's the most hygienic quality. So you can use any type of those straws, so oat, wheat or barley, but the main thing is the gradual introduction of those, and with good teeth. So as long as it's introduced gradually, you can use any of those.
Fab, thank you. And then we've got another question that says, Tracey, that was really interesting about the percentage of haylage that would be classed as wrapped hay. Of the samples on hay last year, what percentage of those tested were less than 10% NSC?
So disappointingly, we didn't have that many samples that were actually tested for their NSC as part of the full package. So based on kind of what I put in the slide, it actually came for some research from Cecilia Muller in Sweden, where they feed a lot more haylage based on her results. So, but I don't know the percentage off the top of my head.
Okay, not to worry. And then we've got one around Dengie feed specifically. So what would you recommend in place of the discontinued Dengie, leisure fits and mins?
Okay, so you're just looking for another kind of, so Dengie no longer have any supplements or balances in their range, sadly, but there are lots available on the market. Again, it's in terms of what's available to you, just looking for a powder broad spectrum vitamin and mineral supplement. There are probably too many to list, but there are some big brands. But if you want to contact us individually about your horse, we can give you some examples on those.
Okay, fab. And are the contact details just on the Dengie website?
Yeah, absolutely.
Perfect. And then we've got another one that says, when hay is tested, is there an average DM range commonly found which could be used as a guide, or does it vary massively? Just wondering if there's something I could use as a guide to work out how much to feed with more accuracy without testing, and then put in brackets large yard where hay supply changes frequently.
Yeah, that's it. It's really hard. I would work with about 85% in years when you know it's been very hot, maybe go 90 or 88, 90.
Okay.
But if you go somewhere around there, you'll be in the rough region.
Perfect, thank you. Right, I think that's pretty much all of them that have come through the chat. So I'm just going to head over to the Q&A section. Right, I think this one's probably best for you, Lily, for the trimming question. What would be a recommended trimming protocol for a recovering laminitis?
Oh, it's quite broad on that one. The general principles are always a nice short toe to reduce breakover, so less pressure on that pedal bone, and a reasonably flat heel. But you normally, if they're shod, you're going to need some level of sort of pedal bone support with your heart bar shoes, plus or minus pads. So depends if they're barefoot or if they're shod, and then exactly how bad the laminitis was. But the general principles are encouraging sole growth and bringing that toe back to reduce the breakover and pressure on the pedal bone.
Okay, thank you. Hopefully that's helpful, Lauren. And we've got another one for you, Lily. So it says, our Welsh mare has had laminitis in the past and had a flare-up 2 weeks ago. This was after her first competition following recovery. Can stress trigger a flare-up? She isn't lame, just warm feet and slightly raised pulses, which 2 weeks on are still the same. If stress can trigger, can you give anything beforehand to dampen down this response? And that's from Elizabeth.
Okay. Yes, there is a theory that stress can trigger it because the stress hormones are your steroid hormones, which also contribute to slightly raised insulin. My question would be whether it's partially the traveling, and also if it's a competition, if it's higher intensity work on not such a good surface, that might have actually been the overload on top of the stress. I'd say if she's still got pulses and warm feet, then you probably should get someone to look at her to check that we're not tipping over into full-blown laminitis. And yeah, I think that's probably the safest option.
Okay, thank you. What else have we got? Is raising heels and short toes helpful to all horses that have had laminitis, or is it case specific?
Yeah, it's pretty much the general principle. I mean, it's very dependent on if you've got such a really thin sole, or and also the size of the horse. It's a lot harder if you've got a big, flat, warm-blooded foot to make those changes, which is why you sometimes need the heart bars and pads combination to artificially change the heels. So yeah, you want a flattened heel-ish as a balancing point, where you want some cushioning, but also it's like you want the actual foot to all shift. So it is quite case specific, but that's the general principles.
Okay, thank you. This is a good one. Is it worth checking the basal insulin of a healthy but very slightly overweight horse just as a guide to managing? So I'm presuming this horse doesn't have LAMI or EMS.
Yeah,
Just a
so
general question.
Yeah, it is where our laminitis risk assessment thing that we've come in is for those types of horses that are a little bit on the heavier side. And the most useful thing is if you test your basal insulin when they've been out for their normal period, so you know what they're at most risk of. If they go out for 6 hours, I mean, it depends on logistics, but if we test them sort of roughly an hour after they come off the grass, that will give you your highest peak of the insulin through the day. Again, the grass contains different sugars through the day, so it's still slightly variable. But yes, if you're going to try and predict the risk, if you turn your horse out for its current normal amount and then test the basal insulin, you know, are they going to be even more at risk if you prolong this turnout?
Okay, thank you. Hopefully that answers that one. And then we've got another one about a Shetland mare who was diagnosed 2 weeks ago with EMS and a level of 274. So your comment on 83% reduction of muzzle use, have you got any recommendations of which muzzles are better than others in order to get that 83% reduction?
So I actually did a grazing muzzle study for my master's dissertation project, because at the time I was regularly recommending muzzles, and there wasn't any research. Subsequently, there has been more research and people have used kind of slightly different types. So I think I'm still kind of right, there's kind of multiple types available. There's the ones that tend to have just the singular hole, and there's some that have kind of slots in there. As far as I'm aware, there haven't been any of the ones studies with ones with the slots in. Most have been with the single hold variety. Beyond that, it's what's going to fit and is most comfortable for your individual pony and what they will tolerate and accept, because there are some now that have got, you know, more breathing space around the nostrils than they used to have, whereas, or they're still the webbing type ones, so the best friend equine and the Shires ones that, you know, been used in the studies as well. So the picture of the pony in my presentation with the grazing muzzle and on the no turnout area was my own pony. I have been through all of this in terms of managing her, and I had to make multiple adaptations to my grazing muzzle by putting bits of sponge or padding or different things in to stop it rubbing. So it's as much as anything about the fit. But once she had got used to hers and once we'd got the fit right, she was very much keen to get that on in the morning and get out into her paddock when she could. So really, I'm afraid, again, I wouldn't say a specific one. You may have to experiment and find one that suits, but generally the Shires one are really quite cost effective, probably a good place to start. But as I say, there's more that are less restrictive around the nostrils today as well.
Okay, thanks, Tracey. And then there's a second question from Heather. In terms of balancers, which the Shetland is on,
yep,
are there some that are better than others for Laminitis?
So you may see some kind of marketed that way. They might have extra added kind of goodies, or might be slightly higher potentially specification in certain areas. Generally, the whole idea of a balancer is that you feed it in very small amounts, so therefore it's not contributing much calorie wise. They all do have a starchy value to them because you need some starch to bind the pellet together. And just one of the things to be mindful of, you know, you probably still want to feed them with some chop to extend the eating time a little bit, to lessen the insulin response and divide your daily portion up into a couple of meals. But no, primarily what we're doing is we're choosing one that's really going to meet that individual's requirements in terms of the vitamins and minerals and everything as well. So for some circumstances, if we're really restricting the grass, I might tell you to feed a performance balancer rather than a leisure one, for example. But in terms of the actual what a balancer is, no, they're all kind of good in that respect.
Okay, good to know. Hopefully that answers both your questions, Heather. So let's do another one for Lily. What are your thoughts on using metformin?
It's been proven to not be very effective. It was, because we had no other options, it was used for quite a long time, and there's still ponies out there that have been on it forever, so they're still on it, but it's been very much proven that it doesn't actually really have much beneficial effect, and that these SGLT2 inhibitors are much more useful. So if your pony's always been on it, then, and you know, you've managed to stave off the laminitis, then you might stay on it, but it's been proven that it doesn't have much clinical effect.
Okay, thank you. And then another one for you, Lily. I might get the pronunciation wrong here. Using Steglatro for EMS. How does this compare to, again, the medication? That's the one.
It is the same drug, it's just a brand name. So there's canagliflozin, the Steglatro, and then we use the bovaertigliflozin just because it's easier to get hold of. So it's the same drug and same category of drug, so it should be as effective.
Okay, thank you. Hopefully that's helpful, Tony. One for you, Tracey. What are your thoughts on feeding turmeric?
So and I would apply this to all of these kind of questions that I get, so be it cinnamon, turmeric, you know, whatever else. If you want to do that, that's fine, and it's safe to the horse to do so. I haven't seen any particular evidence that any of those things are going to significantly, you know, reduce the incidence of laminitis in any way. And it's really important to look at the wider picture, as I just discussed: grazing, forage, and bucket feed from the point of view of a balanced diet. If you want to feed those things, that's fine, but don't be thinking they're going to do something magical, more so than what you can do with your management.
Okay, thank you. One for Lily. Does pergolide for PPID treatment have an effect on insulin levels?
Again, this is where there's a little gap in the current research and knowledge. We know that the PPID has a link to increased insulin. So yes, it does. We don't 100% understand where the link is in the chain. The research just isn't there yet. But we know that if you've got a higher ACTH, you almost always have a high insulin. So yes, you need the pergolide will help at some level by controlling the ACTH. You then consequently control your insulin.
Okay, thank you. And then back to Tracey. Sorry, I'm jumping between the two here, but the questions are a bit mixed. Better to feed a supplement or a balancer? Or
so
both?
it depends on how you're doing it. So as I say, the big difference between the two is that additional lysine that you tend to find in your balancer. So for horses that are on very restricted forage diets, then we may be very short of that lysine kind of in particular. And so that's where a balancer over just a pure vitamin and mineral supplement I would recommend or would be more advantageous. However, as I say, there are amino acid supplements that you can add alongside a vitamin and mineral. So if you're wanting to go as low non-structural carbohydrate and calorie as we absolutely can, and your horse isn't too fussy about having too many powders in their bucket feed, then doing it that way is, really another very good option as well.
Okay, thank you. Hopefully that's helpful to Gina. So we've got one for you, Lily. So the horse has just been diagnosed with EMS and very mild lammy. She had ulcers recently and had to have constant forage and rest. Is it possible that the lammy caused the ulcers, or more likely that the constant food and rest with the ulcers has caused the lammy?
It's an interesting chicken and egg. It's more likely to be the constant food from the ulcers drove the laminitis, because if you've got, it depends what type of ulcers you've got, but to have a pain to drive the ulcers, it would be fairly obvious. So I would have thought you'd seen the laminitis first if it was bad enough and chronic enough to cause ulcers. So it's more likely that not excessive, but the feeding that was right for the ulcers is what's triggered your laminitis. I think I would be right in saying, Tracey, would you agree?
Yeah, so if that's one of the big kind of areas of concern for everybody, is that if we're having to restrict a horse's intake, then what are we doing to their stomach health because of that? If we allow ad lib forage or turnout specifically, then potentially if we're encouraging obesity, then that can link to obviously laminitis very much so. So in terms of balancing both, it's knowing whether your horse has got an increased risk of laminitis in the first instance, which is where Lily and her blood tests come in, and her metabolic health checks. But secondly, kind of more about what I was talking about in choosing your forage types to maximise intake from minimum calories and non-structural carbohydrates. So, if we've got an ulcer-prone individual, mixing that straw into the forage ration, soaking that hay, they're all things that we can do to reduce the calorie and non-structural carbohydrate content whilst maximising their intake as much as we can to keep them chewing for as long as possible.
I think that question really highlights the need to have a huge team approach to this. You get the veterinary advice, the nutritional advice, and just really get everything working together. I've got another question that's probably going to be split across both of you. How much does age affect basal insulin rates? Do you have any feeding tips for those horses with teeth issues who struggle eating tougher hay? So I guess first bit probably Lily, second bit Tracey.
So at the moment, there doesn't seem to be a predilection for increased insulin, but your Cushing's is an age-associated disease, and we know that can drive your insulin. So yes, age does have a factor more from your Cushing side, and just your general sort of slowing down of the metabolism, and also you've got a more chronicity to it. So if your pony's always grumbled along just on the edge, and then they've gotten a bit older and perhaps you've got the Cushing's on top, that can tip them over the edge. So it's not technically a risk factor on its own, but it comes with associated other problems that do make it a sort of risk factor. I hope that makes sense.
Yeah, so from the feeding perspective, the older one with poor dentition, and they might not hold their weight so well. So that's precisely where we're at with Chewy. He's not, not doing so great with his teeth. It needs a bit more to hold his weight. Then that's where we go for the more digestible fibre sources. So if he is still able to chew, then that's where we might start with a haylage, which might be a bit softer than your hay, for example. We'd then progress to short chop fibre feeds as the next step, and then beyond that you'd go for your soaked mashes, all the while looking for the lower sugar and starch options to obviously make them suitable for a laminitis prone individual. So for example, we've got a product called Dengie Alpha Beet, which is alfalfa and unmolashed sugar beet. You can mix that with something higher sugar like our grass pellets to really produce a hay replacer that's still suitable for these laminitis prone individuals. And again, just dividing it up as much as you can, kind of multiple buckets in the stables. You can even get kind of slow feeder devices like the Parallax kind of gradual feeders and things like that have got those spiky bits up like you see in dog bowls that can help to slow the rate of intake a little bit if we're trying to on those occasions as well.
Okay, interesting. I've got another age-related one here from Philippa. So it says, catch 22. My 30-year-old laminitic prone EMS pony lost a lot of weight from having metformin. She didn't need to lose weight. We needed her to regain weight without sugar, which we have now achieved by using oils in a low-sugar feed. Are there any other medications for EMS which don't cause weight loss?
No, because that is the general principle of them. We do get to this conundrum of the skinny but high insulin pony, and that's more where your diet has to come in so you don't have that prolonged high insulin response. So I think, again, the medication side of things, I mean, certainly worth testing from a Cushing side of you if that's also, that might be a contributing factor. But medication, the primary aim is that we reduce the sugars by, and that in turn then causes weight loss. So, you know, you could trial the ersicoflozin for a short-term reduction in insulin, but it will just go back up again if your diet isn't under control. So I think that's going to be something more that you'll have to sort of tackle from that side. The medications are good, but they are essentially just a plaster, and they create that reset. But if you don't have your diet under control and you've still got that constant stimulus and peak, then you'll never be able to achieve it, unfortunately.
Okay, thanks, Lily. Hopefully that's helpful, Philippa. And we've got a question here from Janine. What is the best Dengie combination for a horse with Lamy and ulcer prone? Typical that I just bought the ulcer light, but my vet said I need to change.
Who said that? Sorry, what was that last bit?
Janine. So the last bit was typical that I just bought the ulcer light, but my vet said I need to change.
Okay, so not quite sure of the particular reason for needing to change, but generally if we're also managing kind of laminitis risk, then ulcer light, hi-fi molasses free, healthy Who's molasses free, and meadow light with herbs are all kind of very suitable options for both laminitis and gastric ulcer management as well.
Okay, thank you.
In a lower calorie format, I should clarify.
Right. I'm going to do two more because I'm just conscious of time. What are the standard costs for the spring and autumn EMS testing?
That's a very good question. I should know these off by heart by now. I think obviously this is our practice specific. I believe our health check is, I think it's about £150 without the x-rays. So that includes all of our sort of time and the blood samples themselves. The x-rays are an extra cost, which I think it's another 100 and something pounds. So you're looking at least £300+ for the whole shebang. And then if we did say just your blood test on your own, so we'd run if we were running a Cushing's and an insulin, that comes to, I think it's £75 for the two, plus the visit and extra charges for examining and things. So again, your preemptive health check, I'm not going to put words into mouth, but might not be covered by insurance as it's a preemptive thing. So it's just that it is a significant cost. We've cut it down as much as we can to try and make it sort of accessible for people, but it does, you know, there's the lab fees and the time, so it does come at a reasonable price, I'm afraid.
Okay, thanks, Lily. I've just had some good questions come in from George Ena, who I think is copying and pasting them from the chat section. So I might end up doing slightly more. So we've got one that says, my horse is not improving on pergolide. Is that the correct pronunciation?
Mm-hmm. Yeah.
Fab, doing well. He shows all the signs of PPID besides positive bloods. Should I just take him off the pergolide? He had winter Lammy in December and Lammy out of nowhere again whilst being on grass-free track system. I'm at a loss.
Okay, so I think there's a few different things you can tackle there. So the pergolide, as I said, it doesn't work for all horses, and you don't always get a positive on the blood. So you could ask your vet about switching to the cabergoline. It works on a slightly different receptor within the pituitary gland, so that's an option. And then in terms of the sort of unexpected laminitis, that means your insulin has spiked, so something has been triggering it. So I think it's worth getting a test done for your basal insulin when on the track system to work out, because the problem we're having at the moment, I think you agree, Tracey, is the little shoots come through on the grass, and they're actually very sugary, but you don't necessarily see them because the horses almost eat them quicker than they can come through. So I've had quite a few that are on restricted turnout and or just mud tracks, but they're still getting laminitis because those little shoots come through. So I think it's probably worth having a further investigation into your management and what your insulin levels are at now, and possibly trialing the cabergoline instead.
Okay. Just related to that one, is short grass or long grass best?
So you will find lots of conversations about this. It's really the amount that your horse can eat at the end of the day.
Right.
And if your horse has got an underlying problem at times like now, because last week we were still having very low overnight temperatures but sunnier days, it may be best to bring them off the grass altogether if you know that they've got an underlying issue, rather than just assume. But ultimately, even if you've got a higher non-structural carbohydrate grass, if you're very much restricting the area, the amount they have access to, they might still consume less than if you've got a low non-structural carbohydrate pasture, but they can access lots of it. It all balances itself out. So it is really all to do with the amount that they consume and their underlying risk. And if you know they've got that underlying risk, then now might not be the most appropriate time to unfortunately have them at pasture. And I know that's not what everybody wants to hear, because we all like to turn our horses out. It's a good thing to do, but as I say, with my pony that I had, I very much couldn't turn her out to pasture. She was still very much at risk, so I had to make alternative plans and arrangements.
And just, I guess, related to that point, is it a myth, or is it true that there is less sugar in the grass overnight? Or
That is true to a degree, depending on what's going kind of on seasonally, but generally this is all about kind of plant photosynthesis. So during the daytime, when the sun is shining, the grass is photosynthesizing, they're accumulating non-structural carbohydrate, but as long as temperatures are good and environmental conditions are good, they'll also be using those non-structural carbohydrates to grow. So over the nighttime period, when the sun isn't shining, as long as the temperatures are high enough, the grass will still be growing, so it will be utilising more of those stores. So by the morning, the levels of non-structural carbohydrate tend to be lower, which is where the advice about turning out early in the morning and bringing off pasture by mid-morning comes from. However, again, this all relates to amount. If you, for example, have got a laminitis-prone individual and you think in the summer months, oh great, I'll turn them out overnight because, potentially they'll have kind of lower levels of non-structural carbohydrate. For the period of time that they're out for overnight, they could be consuming way more than your limited grazing period, perhaps if you turn them out in the daytime. So it's balancing both of those things, I'm afraid. But ultimately, it's what works for you. If you've been doing that and you've got a horse that doesn't have a problem and it's working well for you, that's fine. But if you're coming across repeated incidents of laminitis or not quite managing to get it under control, then you need to have a rethink.
Okay, thank you. I'm going to call it there because I'm just conscious that we've ticked over 9 o'clock. There are tons of good questions in there. So to everybody on the webinar, if we didn't get to your question, firstly, I'm very sorry. We will be following up with some emails, and I will include an email address in there. And if you've got any more burning questions, please do email them over to us and we will distribute them to Tracey and Lily and get back to you. It might not be tomorrow, but we will get back to you over the next few days or in the next week or so with an answer. So I just want to take this opportunity to say a massive thank you to Tracey and Lily. This has been such an interesting webinar and definitely our busiest webinar to date and most active Q&A. I think, there's nothing straightforward in the world of laminitis, and it's all case-by-case basis, and what works for some people might not work for everyone. But this has been so useful. So yeah, huge thank you, and huge thank you to everybody who has dialed in and spent their Tuesday evening with us. Keep an eye on your inbox. We will be in touch with some follow-up material, and as I say, the email address where you can ask your questions that we may or may not have got to. So yeah, so I hope everybody enjoys the rest of their evening. Thank you very much.
Thank you.
Thank
Bye-bye.
you. Bye.